my name is Maia Sugars. I'm a medical science student. What's your name?
TJ.
Nice to meet you, TJ. So today I'll be performing an abdominal examination on you if I have your consent.
Yes, you do.
Okay, perfect. Let me wash my hands first and then we'll get started. So first I'm just gonna inspect your body, make sure everything is up to par. So right now I'm inspecting the abdomen from above for any symmetry, contour, and any visible abnormalities. So assessing for symmetry, I'm just making sure both sides of the abdomen should rise and fall evenly with respiration, with no visible bulges or distension. Assessing for contour, I'm just noting whether it appears flat, rounded, scaphoid, or protuberant. And then I'll also inspect the skin, looking for any scars, striae, rashes, lesions, or dilated veins. And moving to the umbilicus, I'm checking for any signs of inflammation, bulging, or hernias. Overall, the abdomen appears symmetric with a flat contour and no visible lesions, scars, or abnormal pulsations. Everything seems normal. Contour is flat. You don't have any scars, striae, rashes anywhere, which is good. So after inspection, I didn't notice anything out of the ordinary. Your abdominal symmetry is good. Contour is fine. You didn't have any scars, striae, rashes, or anything anywhere, which was fine as well. Your belly button or your umbilicus, it looks pretty normal. Everything looks up to par. Now I'm just gonna listen to your stomach with my auscultation of the abdomen is always performed before percussion or palpation, since those maneuvers can alter the frequency of bowel sounds. I'll first begin by warming my hands and the diaphragm of my stethoscope to keep the patient comfortable. Then I'll be listening for bowel sounds in all four quadrants, using gentle pressure along the mid-clavicular lines. I'll pause briefly between quadrants to appreciate the frequency and character of the sounds. Normal bowel sounds are typically high-pitched and gurgling, occurring about 5 to 34 times per minute. Hyperactive sounds may indicate diarrhea or early obstruction, while absent sounds could suggest ileus or peritonitis. As I was listening, everything sounded normal. There were no hyperactive sounds nor absent sounds. Now I'm just gonna continue listening some more, just looking to see if I hear any bruits or anything. Bruits is basically just an abnormal swishing sound. Just making sure that's up to par. Now I'll be listening for bruits, which, as I explained to the patient, are abnormal swishing sounds from the blood flowing in the artery. I'll start over the aorta, which is just below the xiphoid process in the midline. Then I'll move slightly lateral to listen over the renal arteries at the level of L2. I'll continue downward to auscultate the iliac arteries, approximately 2 inches below the umbilicus on each side. And finally, I'll listen over the femoral arteries in the groin area. As you can see, I slightly pulled down his underwear so I could get to those. The absence of bruits suggests there are no significant vascular abnormalities such as stenosis or aneurysm. Overall, bowel sounds are active in all four quadrants and no bruits. Okay. I didn't hear anything abnormal as far as bruits or swishing sounds. Everything sounded normal and up to par. I'm just gonna measure your liver span. To assess for the liver span, I'll first begin at the chest area just below the nipple, and I'll percuss downward along the mid-clavicular line until the sound changes from tympany to dullness. That marks the upper border of liver dullness. Yep, I say the dullness starts about right there. And then I'm going to go at your belly button. Exercise, please. Thank you. Then I'll begin below the level of the umbilicus in an area of expected tympany and percuss upward towards the chest until I hear a change of tympany to dullness, marking the lower end. Yeah. So I'd say your liver span is about right here, which is about normal. Perfect. Now I'll just be assessing your spleen, making sure everything looks normal and that it's not enlarged. I'm standing at the patient's right side and will begin percussion over the left lower interior chest wall. I'll first percuss the area while the patient is breathing quietly. I should hear a tympanic sound. Then I'll begin asking the patient to take a deep breath and hold it while I continue percussing the same area. If the sound changes from tympany to dullness during inspiration, this suggests that the spleen has enlarged downward and anteriorly. This is known as a positive splenic percussion sign, which indicates possible splenomegaly. In my patient, the percussion note remained tympanic the entire time, which suggested a normal spleen. All right, perfect. Throughout the whole time, everything was tympanic, which means it was normal. Now I'm gonna begin palpating your stomach. If I could have you sit up a little bit. Just a tad bit. I'm adjusting the pillow. And then could you bend your knees for me? Lift your shirt up a little bit. So right now I'm just gonna lightly touch and just feel your body. Palpate your body. Let me know if you feel anything that hurts or any tenderness. Okay. I'll start off with light palpation, keeping it flat and moving in a smooth, gentle, and circular motion. I'm assessing for tenderness, guarding, or any superficial masses. I'll palpate systematically through all 9 regions of the abdomen: the right upper quadrant, epigastric, left upper quadrant, right flank, umbilical, left flank, right lower quadrant, suprapubic, and the left lower quadrant. I also decided just to repeat the 4 quadrants, being the right upper quadrant, the left upper quadrant, the right lower quadrant, and the left lower quadrant, just to be sure. After assessing the different quadrants and regions, I didn't find any masses or anything out of the ordinary. I decided to let my patient know that and then to let him know that I was going to move on to deep palpations. Okay, so I didn't feel any masses. Now I'm just going to go a little bit more deeper. Let me know if you feel any tenderness or pain, okay? Okay. And let me know if I'm pressing too hard. For deep palpation, I'm going to press about 3 to 4 inches deep into the abdomen to assess for deeper masses or organ enlargement. Again, I moved systematically through all 9 regions, and I also went through the 4 quadrants. Overall, there was no tenderness, guarding, or palpable masses noted in any of the 9 regions, and the patient appears comfortable throughout palpation. Okay, and then can you let me know if you feel pain right here? See? You sure? Oh, okay. And then right here? Okay, perfect. So first, I'm just going to be looking at your liver edge. I'm palpating the liver edge to assess for size, contour, and tenderness. I'll place my left hand posteriorly beneath the patient's right lower ribs to lift the liver upward and position my right hand just below the right costal margin along the mid-clavicular line. I ask my patient to take a deep breath in. As they inhale, I'll feel for the liver edge as it descends under my fingertips. If palpable, I'll note its texture, consistency, and tenderness. A normal liver edge is usually soft, smooth, and non-tender. In this patient, the liver edge is not enlarged and non-tender. I'm just going to try to palpate your kidneys. To palpate the kidneys, you should move to the side you're examining the kidney on. You'll place your opposite hand behind the patient below the 12th rib, which is the costal vertebral angle. Lift and try to displace kidney and feel with the other hand. Ask the patient to take a deep breath in and to hold it. At the peak of inspiration, press hand firmly and deeply into the left upper quadrant, just below the costal margin. Try to capture the kidney just below your hands. Okay. Now let's move to the other side. Repeat the process for both kidneys. For the right kidney, it should be palpable if the patient is thin and relaxed. One more. Okay, cool. Thank you. Everything seems up to par. Okay, and for the last thing right quick, I'm just going to look at your aortic width. Using the pads of my fingers, I palpate just above the umbilicus, slightly left of the midline, applying slow, firm pressure towards the spine to feel for the pulsation of the abdominal aorta. I gently assess the lateral edges of the aorta to estimate its width, noting that a normal adult aortic width is less than 3 centimeters. I ask my patient to take a deep breath as well. So that right there, which is pretty normal. I'd say that's around 3 or 4 centimeters, which is pretty normal. And on that note, I don't see any reason to do any special techniques on you. So on that note, I believe we are all done. Thank you so much, TJ, for letting me examine you. It was a pleasure meeting you. Thank you.